Hello, my name is Zwai Bala. I want to tell you Tabo's story. 2 weeks ago, Tabo was feeling very weak. He was coughing a lot. He woke up sweating in the night and was losing weight. He went to his clinic, and after the nurse did a few tests, she told him that he had TB. Tabo asked his doctor what he could do to get well again. TB is tuberculosis. It is a sickness of the lungs. Small drops of saliva or spit with TB germs are coughed into the air by people who have TB and then breathed in by people who do not have TB. This is how the disease is spread from one person to another. Anyone can get TB. If they live in a crowded place and share the same breathing space with others, are underweight, have HIV, or are not healthy. Famous people like President Mandela, Desmond Tutu, and Margaret Gardner have all had TB but are now cured. TB can now be cured. You must take the TB medicine exactly as the doctor or nurse tells you. They will give you different drugs to kill the TB germs in your lungs. They will tell you when to take them. You must visit the clinic often for them to check your saliva or spit. You will only be cured when there are no germs left in your lungs. TB germs die very slowly. It will take at least 6 months for the drugs to kill the TB germs. It is very important that you take the tablets for the full 6 months to make sure that the TB has been cured and you will not get sick again. You'll start feeling better after a few weeks of taking the TB tablets, but this doesn't mean that you're cured. Beware, the germs are still alive in your body, and that's why it is important to take the TB drugs until the germs are completely dead, even if you are feeling better. Depending on the medicine you're taking, your skin could get sensitive to the sun, birth control pills may not work, your tears and other body fluids can turn yellow. These things will not be painful and you should keep on taking your drugs. But if you're vomiting, have a skin rash, sore joints, feel hot, or have aches and pains that you don't normally have, you must tell the clinic. If you forget to take your TB tablets one day, you must leave the drugs that you are supposed to take and only take your medicine the next day. You must tell your doctor that you forgot to take the medicine for one day. Here are ways to remember your tablets. Become part of the DOTS program. Ask your nurse about it. Take your tablets the same time every day, like after brushing your teeth in the morning. Ask a family member to remind you. Tick each day on a calendar as you take your medicine. Having TB should not stop you from doing things that you always do. When you can no longer pass on the TB germs to people and you are not feeling sick anymore, you can do everything that you did before you got sick. Your drugs will not make you so weak, you can't work or enjoy everyday things or have sex. HIV already makes the body weak. The body has to fight very hard to stay healthy. The symptoms of HIV and TB are very similar, and that is why so many people end up not realizing that they have TB until it is too late. Remember, TB can be cured. When you know you have TB and start taking TB tablets, you can still spread it to others. It is important that you stay home and don't go to school or work so that there is less chance of giving it to others. You may go to work or school only when the doctor has told you that it is safe. The most important thing is to take your medicine as the clinic has told you and go to the clinic for all your checkups. Your doctor will do some tests when you get there to make sure the tablets are working and tell you whether you can still give TB germs to other people. TB germs spread through the air. You cannot give TB to other people by touching them, sitting on the same toilet seats, or sharing dishes. While you can still give germs to others, you must do these things. Always put a tissue over your mouth when you cough, sneeze, or laugh. Then put the tissue in a paper bag and throw it away. Do not go to school or work yet. Sleep in a bedroom away from others. Open your windows so that you can let in fresh air from the outside into your bedroom. You could use a fan in your window to blow the air with germs outside. Tabo has been taking his TB medicine like his doctor told him for 2 weeks now, and he is feeling a lot better already. He wants to be cured so that he can live a long, happy life with his friends and family. Thabo is going to keep on taking his medicine for 6 months to make sure he gets cured. This is Bala here again. I hope you will do the same. Please look at the back of the book for a clinic or place to find help in your area. Remember, TB can be cured.